So thank you so much. It's really a pleasure here to talk with all of you and hear the really great collaborations that are occurring. This is a vital discussion for One Health and a way to bring folks together. I want to first start with thanking the folks who put this together. TGen North, the University of Arizona's One Health Research Institute, and Ending Pandemics Academy, all within the Mel and Enid Zuckerman College of Public Health, for hosting this event and for bringing everyone together to talk about really these important research questions. When people ask me about my work as a transplant surgeon and researcher in regenerative medicine, they often ask me to talk about surgery, what it's like in the operating room, complexity of transplants and putting new organs into patients. And these are profound moments of my daily life. But when I think about environments, there's an internal environment and there's also an external environment to some of the work that I do. Looking at the liver and the scaffolding, the cellular architecture of a kidney and how an organ makes urine, right, when you connect the vasculature. It's quite delicate, but in order for those transplants to survive, the environment has to be right, both in the patient's body and also externally. So when they get discharged to go home, important that they're breathing clean air, drinking clean water, engaging with the environment out and walking around. And so every surgeon learns this, and that really helps healing, both in surgery and our health in general. And that really underscores the importance of One Health and the research that you all are doing. So I joined the Office of Research and Partnerships to oversee the health research portfolio. And if you've listened to my boss, Dr. Tomas Diaz de la Rubia, really talk about convergence and bringing folks together. And so for decades, universities have encouraged researchers to talk across the aisle, and that's a good start, but we need to do more. And that's what you all are doing here today. And so the Office of Research and Partnerships, we define convergence as a true transdisciplinary integration of different and disparate fields. And so this is a moment where life science, health research, physical sciences, engineering, data science, all come together to form collaborations. And if that sounds familiar, it should. And so One Health is not just many different researchers and topics at the University of Arizona. One Health is really the premier example of bringing folks together and demonstrating that complex example of convergence, research, and action. It's a framework that really allows the ecologist and the veterinarian and the public health official to work together along with atmospheric scientists to stop working in parallel and to start working as one integrated team. And so convergence is about creating solutions that are bigger than the sum of the whole and their parts, solutions that transform abstract ideas into tangible impacts for our communities. However, as many of you discussed today in the sessions that went on over the course of really the last 2 days, there's often a gap between the philosophy of One Health and the operation of it, so where the rubber hits the road. And we heard a lot of that this afternoon, and that really also came into play in the questions that were asked just in the last session. And so it's easy to agree that human, animal, and environmental health are all linked, but it's much harder to build that system that monitors those actions in real time. And so what we're faced now with really a paradox is, we have more information than ever from all of these different disparate fields. In Yuma, there's soil sensors, there's satellite imagery of different migration patterns for birds or other animals, clinical records from our hospitals, and genomic sequencing data. But then how do we build all of that together and integrate that together? And so that's convergence. It can be fragmented sometimes, trapped in different languages and different softwares and different laboratories. We can see pieces of that puzzle, but that whole picture is often difficult to see. And so to operationalize One Health, we want a way to synergize all of these different and disparate data sets into actionable intelligence. And so that's where AI can help. We saw a little bit about that today. And this AI-driven health integration is a strategic research initiative. And so this initiative at the University of Arizona's commitment to leading the world in transformative AI and machine learning and solutions that really define the future of health. And so when we talk about AI in health, for instance, people often think of a chatbot or ChatGPT, or looking at an X-ray and trying to find where a lung nodule might be or a breast cancer might be. But our vision is much broader than that in our work, and so we're using AI to provide digital infrastructure that's so important to research and to way that all of you are doing today, and that a lot of you had discussed about really that convergence and how AI can do that. And so through AI, through the AI-driven health innovation initiative, so we're supporting the work that moves the needle. And so we're building AI into various solutions for digital epidemiology and modeling by analyzing patterns and environmental shifts in animal health data. And so we can model the disease spillover before it reaches the human population. So some of that is the ending pandemics work. This is often a shift from a reactive medicine to really a predictive global health security system. And so convergence also means bringing the high-tech capabilities of our labs in Tucson and Phoenix to the most rural and tribal communities in our state, and across the different states as well. And so I want to thank all of the folks who came from afar. And so AI-driven telemedicine and digital diagnostics allow us to monitor health in real time regardless of geography. And AI also allows us to curate data from the environment, from air quality to pathogens to soil and health, to integrate it directly into public health records. This allows us to move from One Health from a theoretical framework to now a functional real-world dashboard of policy makers. And so in everything we do, from our focus to responsible use of AI, and we heard some questions from folks from the responsible use of AI, the Institute, these technologies are integrated into One Health. And so we're mindful of the ethical, legal, and the social impacts. We're not just building algorithms, we're building trust. And this means ensuring that our AI models are transparent, that they respect sovereignty of tribal data, and that they are designed to reduce, not exacerbate, health disparities. And so our goal is to train a new generation of professionals who are fluent in the language of health and biology as they are in the language of artificial intelligence. This is the workforce that will lead Arizona into the next century. And so as I look around the room, I see One Health in action through the presentations and the questions that we saw today. And so there are researchers here who are willing to step out of their comfort zones, and I see students also who don't see boundaries between environmental science and medicine, and who see that convergence between the two. And so you're the primary reason that our Office of Research and Partnership exists. Our role is to build that ecosystem with you, where your knowledge can be continuously translated into economic prosperity and social good. And so we're at a unique moment in history. And so at the University of Arizona, it's with our deep expertise in space science, in agriculture, in medicine, and now AI, is the only place where this kind of convergence can take place. Otherwise, it couldn't happen. And so I want to leave you with a final thought from my perspective as a surgeon in the operating room. The timing is everything, so a delay of a few minutes can change the outcome of an organ and how it functions in a patient's body. The same could be true of our planet, and so we don't have the luxury of waiting for silos to break down. And so that's what you're doing today. And so you're being intentional and being bold. And the One Health philosophy with AI as the engine, allowing that convergence to happen with all of you as the drivers of that machinery. So as you leave today, I ask you to carry this spirit of convergence back to your labs, sometimes to the different states where you're coming from, to your clinics and to your classrooms. And I thank you for your dedication, your partnership and the impactful work you are doing on behalf of the University of Arizona for the betterment of society. So with that, I want to thank you, Dr. Van Hippel, and thank you all for having me come to speak. So thank you.
Thanks a lot.